Good afternoon. I am here today to report 3 new cases of COVID-19 in Prince Edward Island. This is disappointing news, but we have said consistently that we need to be prepared for more cases, and we are. None of these 3 cases are related to seasonal residents or the opening of the Atlantic bubble. One case is a male in his 50s who is an essential worker who recently traveled outside the region. He has self-isolated since returning to the province and is at home. The other 2 cases are individuals in their 20s. We believe that these 2 cases are connected, and one case is related to travel to Nova Scotia, where he had contact with someone from the United States. He is asymptomatic. The other case, a female, is symptomatic and is a close contact of the male. She works at Whisperwood Villa and recently worked at the home. She did wear appropriate PPE while working and does not provide direct personal care to residents. She left work as soon as she was not feeling well. We made initial contact with the management of Whisperwood Villa late last evening as soon as we became aware of the positive case. As a precaution, steps are being taken to test all residents and staff of the Whisperwood Villa beginning this afternoon. Staff will be contacted individually regarding the process to get tested, and resident testing has already started. I've been told that none of the residents have any new symptoms of COVID-19. As an additional precaution, I'm also asking that anyone who visited Whisperwood Villa on Tuesday, June the 30th, be tested. Again, these individuals will be contacted directly regarding the process and timing to be tested. The lab has advised that test results will all be available within 24 hours. In addition, contact tracing of the cases through public health nursing has started. Early and comprehensive contact tracing is key to containing further spread of COVID-19 in our community. We are working together with Whisperwood Villa, and we know they have been diligent about following the guidance from our office since the pandemic began. We have been advised that all indoor and outdoor visits are canceled until further notice, and there will be no communal dining. The frequency of resident temperature checks will increase to twice a day, in addition to twice daily screenings. We are working with Whisperwood Villa to ensure they have the supply of personal protective equipment they need. While I believe the risk of spread is low at Whisperwood, given the staff member wore appropriate PPE and did not provide direct care to residents, our top priority is to prevent further spread of COVID-19 to residents and staff of Whisperwood Villa and in the community. The safety of our residents, our staff, and islanders is our primary concern. We are contacting individuals who need to be tested, staff of Whisperwood, and visitors to the home on Tuesday, June the 30th. We are working collaboratively to take all steps necessary to mitigate any spread of COVID-19 in the facility and keep residents and staff safe. Community paramedics from EMS have been deployed to Whisperwood Villa to assist staff with resident testing. The QEH has been notified of the situation at Whisperwood Villa and are preparing to receive ill residents if needed. In preparation for an outbreak of COVID-19, staff at all long-term care facilities, including Whisperwood Villa, received training in infection prevention control and steps to minimize transmission among residents. I understand this news is very concerning for residents and staff, their families and loved ones. Whisperwood Villa is in the process of contacting families, and information will continue to be directly shared with families and loved ones as it becomes available. We are still experiencing a global pandemic, and we did anticipate new cases of COVID-19. We are ready to deal with this situation, and are confident in our capacity to respond to this outbreak in terms of testing, contact tracing, and self-isolation. We know from experience in other provinces that contact tracing within the first 24 to 48 hours has made a significant impact in the containment of the spread of COVID-19. The situation is a clear reminder of how important our messages have been. Keep your circle of contacts small. Physical distance, social distance, stay 6 feet apart. And if you cannot physically distance, wear a non-surgical mask is being recommended. Wash your hands frequently. Do not go to work if you are feeling ill. And if you have symptoms of COVID-19, call 811 to arrange to be tested. We have strong public health measures and protocols in place. However, they will only be effective if they are followed. COVID-19 has not gone away, and each of us has a responsibility to keep each other safe as we learn to live with the pandemic. So, more important than ever, let us look out for each other. Let us look after each other, and let's please be patient and please be kind. Thank you. And I think I'll open it directly for questions for myself or the Premier.
Travis Kingdon, CBC.
Hi, Dr. Morrison. Just wondering what the impact this might have on the newly formed Atlantic bubble with 3 new cases now in the province.
You want?
Do you want me to start?
Sure.
As Dr. Morrison indicated in her introductory remarks, Travis, that as of right now, nothing has changed in terms of the Atlantic bubble. The 3 cases outlined, the 3 positives are not connected to the Atlantic bubble, but at the same time, we have been following public health directives and following the epidemiology. So I think Dr. Morrison and I talked earlier this morning, and we will take the next 24 to 48 hours to allow the contact tracing and the Chief Public Health Office to do what they are prepared to do. And we will let the information guide us at that time. We've said from the very beginning, if we need to pull back, we would. And if the public health information and the epidemiology points in that direction, then we would be prepared to make a decision on pulling back early next week if that's where the information points to.
Question. Of course, inside the homes there, we heard about the rolling back of some of the freedoms that we've seen in there with the dining rooms and the visitations and things like that. Are we going to see any more changes to where the province sits in the phases with these new cases? Are we going to see more restrictions brought back?
Hi, and I think you're referring to even the visitation phases, and I think we'll know more in the next 1 to 2 days as we test the residents and the staff and those who may have been visiting. And so I think that decision about how we proceed with some of the phases in long-term care visitation will need to be made as we get more information.
Sid Bannery, Canadian Press.
Hi, Dr. Morrison. I wondered if you could, I'm calling you from Montreal, and I wondered if you could repeat in French sort of the basics of your announcement today.
Je vais essayer. Bonjour. Aujourd'hui, on annonce 3 nouveaux cas de COVID-19 ici à l'île du Prince-Édouard. C'est 67 jours depuis qu'on a annoncé un cas ici à l'île du Prince-Édouard. Alors, c'est pas des nouvelles qu'on aime annoncer, mais c'est pas surprenant parce qu'on est encore en train d'avoir une pandémie globale. Les 3 cas, un des cas est dans les 50e et il a voyagé hors de la région atlantique, mais au Canada. et puis il s'est auto-isolé chez lui à l'île du Prince-Édouard depuis qu'il est retourné. Les deux autres cas sont les 21e âge et puis les deux cas sont reliés, ce qu'on croit, et un des cas a eu un contact avec quelqu'un qui a voyagé aux États-Unis quand il est à Nouvelle-Écosse. Et puis, l'autre cas travaille long-term care ici à l'île du Prince-Édouard. Alors, on est en train de faire les tests de tous les résidents, les personnes qui travaillent et puis les visiteurs à l'endroit. Alors, et on est en train de faire les tests des autres contacts et ils sont tous isolés chez eux à ce moment.
Sean McDougall, the Eastern Graphic.
Good afternoon, Dr. Morrison. I'm just wondering if you could clarify something for me. The young male who contracted the virus in Nova Scotia after coming in contact with someone from the United States, can you clarify how they traveled through the Atlantic provinces and when this was? I know you said that none of the cases are related to the Atlantic bubble.
Yes, I mean, and so we are certainly trying to get more detail from this particular case. So I think we'll all learn more. But my understanding is that he traveled by vehicle back to Prince Edward Island on June the 29th, and that is what I know at this point in time.
Okay. And just to follow up with the Premier, the Premier of Nova Scotia said he won't turn visitors from the United States away, or cars with American plates on their vehicle away. Has this case of the gentleman who contracted the virus from someone in the States, does that bring sort of a new dynamic to the conversation in trying to isolate the Atlantic bubble from outside visitors anymore?
Well, I mean, as you know, Sean, that any Canadian citizen is able to travel back to their home country, regardless of where they live, and there's also a family reunification component of that as well. We require anybody coming from outside of Atlantic Canada to have a self-isolation plan and to stay in self-isolation for 14 days. They are subject to our Operation Isolation operation, and we are testing them before they would leave, similar to what we're doing with seasonal residents from outside of the region. So I think that we haven't had a conversation much beyond that, I don't think, but I think both Dr. Morrison and I are very, very concerned when we look at the dramatic increase in cases south of the border. And she has encouraged me for a number of weeks, and again today on our calls with the Prime Minister and other premiers, to encourage that American border stay closed for an extended period of time. And I don't think anything has changed in that regard. But like everything else, we continue to reevaluate based on the best health information that we have, and if we need to alter what we're doing here in PEI in the days ahead as it pertains to visitation from outside of Canada, we will certainly do that.
Laurent Rigaud, La Voix acadienne.
Oui, bonjour, docteur Morrison. J'aurais juste une question sur si vous pouviez réexpliquer les mesures qui sont en place dans le foyer pour personnes âgées en français, s'il vous plaît. C'est un foyer à Charlottetown, c'est bien ça?
Bonjour Laurent. Alors, oui, c'est un foyer pour une place pour les âgés ici à Charlottetown. Et puis, ils sont en train de contacter les familles des résidents et puis les employés pour qu'ils soient testés. Aussi les visiteurs qui ont fait la visite au foyer le 30 juin. Ils sont en train d'augmenter le nombre de fois par jour qu'ils font la température et demandent les questions aux résidents. Les personnes, les visites sont arrêtées pour l'instant. Aussi, ils ne vont pas manger aux salles de manger ensemble. On est en train de s'assurer que tout le monde a assez d'équipements protectifs personnels et on travaille très bien avec le foyer parce que il faut faire ça ensemble pour protéger tout le monde.
Merci, je n'ai pas d'autres questions.
Merci.
Mike Robar, The Guardian.
Good afternoon. I'm wondering if either you, Dr. Morrison, or Dennis, if you're worried about the effect this might have on islanders who are already hostile to off-island plates and the opening of the bubble.
Well, can I start, Heather? Yeah. Sorry, Dr. Morrison. I think that the three cases, positives that are being indicated today, as our previous cases that we've had, are islanders who have come back home from travel outside of the province. So I think it would be important for all of us to remember that, and to remember that we all have a responsibility to follow the public health directives very closely, and we're grateful up until certainly today that those who have been contracted the virus have been adherent to self-isolation. But I think this also shows that, as Dr. Morrison has talked about for a number of weeks now, that COVID has not disappeared. It is still here. And maybe for the last number of days here in the province, we've felt that, we're maybe more immune to it than we really are. So I think this is certainly should be a wake-up call for everybody, and I think islanders should remain aware that these three individuals are islanders, and we've talked for 13 weeks now that COVID doesn't really care much about your license plate or your background or your geography. So we all have a responsibility here to follow the public health directives, and I would hope that islanders realize that. But it's certainly, quite honestly, it's, I think both Dr. Morrison and I, when we heard the news, it's not what we had hoped to hear, and it's, a bit of a gut shot, to be honest, but it is reality that it's still here. And I do have great faith in the public health office. The protocols that we have in place, I believe, are the best in the country, and we've demonstrated that. And now I'm making sure that under the watchful eye of Dr. Morrison and her staff, that our public health experts will go to work and do what they've been preparing to do for a long time.
And Dr. Morrison, if you have nothing to add, I'll just ask another question.
Go ahead. No, I think the Premier said it well.
Perfect. Do you know how long the procedures at Whisperwood Villa will be, the rollback procedures, how long they'll be in place?
No, I don't know at this point in time, but I think the important thing will be to get everyone tested as quickly as we can, and then we'll be in constant communication with Whisperwood Villa about next steps forward.
Thank you.
Okay.
We'll open up to any additional questions from members of the media.
Hi, Dr. Morrison. It's Sid Banerjee again with the Canadian Press. I just wondered, are employees of long-term care or seniors homes, are they allowed to work in multiple homes or residences in PEI? And are there any new rules that will be put in place as a result of what you're announcing today?
So in Prince Edward Island, people who work in long-term care facilities are not permitted to work in other long-term care facilities. So that has been in place, and we certainly wouldn't change that at this point in time. So I think we'll continue to look at that and make sure that staffing is always a concern, and we recognize that in both our private and public facilities. But at this point in time, that is what is in place here. And I know in this particular case, it was Whisperwood Villa reminded us this morning that none of its staff are working in other long-term care facilities.
Okay. And do you have an idea, or I don't know if Premier King would want to answer this one, sort of like what would cause PEI to put its reopening measures on hold? Is there a number that you have in mind, or is there a number of cases or instances that would cause that to happen?
I can start. I mean, we've said at different points in time, what would the triggers be? And so we look at a number of things. I mean, our capacity and as a health system to manage what is going on. We look at not just the number of cases, but what is it? Community spread? Is it well contained? Are we able to? Is it related to travel, international travel, where someone has self-isolated? It's based on a number of factors, and our ability to do good contact tracing and testing. All those factors play a role into a decision to put even more restrictions in place, or to reintroduce some of the restrictions that we've had in place and opened up.
If there are no further questions, we'll perhaps wrap this up.
Great. Thank you very much.
Yes, thank you. Thank you, Dr. Morrison.